clearly not only working in the health service, but I have a number of health conditions that make me more vulnerable to COVID, and I've been self-isolating and shielding as much as possible, as well as working over all this period. I think the big one, I mean, it's a voluntary and everyone chooses for themselves, is to find out the right information and to make sure that they don't get put off by a lot of the myths and things that are around. Look at it, there's lots of information out there from reliable source, from the government, from the NHS and others, which show that it's safe, that it's, you know, that it's been well tested and everything. And part of it is, yes, just to encourage everyone to say that it is safe to take, and we do our little bit for the community.
To be honest, I was in two minds about getting my vaccine. I've got family reasons for that. And so basically what I did, I sat myself down and wrote out all the reasons why I should take the vaccine, and all those reasons had nothing to do with me, but had more to do with my familial responsibilities. So my experience of having the vaccine was, it was easy. So that there's a system. I was at South Hospital, there's a very clear system. There are forms that you need to fill in for consent. There's lots of information. And when you go and see the nurse, they're very approachable. They kind of tell you what they're doing and what's going to happen. And then there's time for you to sit and rest afterwards, especially if you're quite an anxious person. There is adequate time for you to sit, rest, kind of reflect while they book you in for your second appointment. I would say to someone who is unsure, actually sit down, write out the reasons why you shouldn't have the vaccine, why you think you shouldn't, and the reasons why you should. And I can guarantee that the reasons why you should will far outweigh the reasons why you shouldn't. It's not about me, it's about everyone else. And I think when you come with that mindset, the reasons why you should have the vaccine will become really clear and apparent to you.
I wasn't nervous today because I've had lots of vaccinations in the past. I've never had an problem with it, and I feel that they're a very safe thing to have. I've had a few friends that have said to me, oh, you know, it's gone through really quick and I'm not sure how safe it is. But I've worked in research, and I know the only reason why this has gone through so quickly is because so much funding and resources put into it that it's been able to have been done in such a short space of time. I also know the regulations that it has to go through, and I know that it will have been tested within an inch of its life and that it's perfectly safe. It's important to have a vaccine because I want to protect myself, I want to protect the patients. I'm a healthcare worker, so I want to make sure that my patients are safe. And until, you know, we can get as many people vaccinated as possible, then our lives aren't really going to change.
When I was coming over here to have my vaccine, I think I get around phoning a few friends that from my background to say, I'm going for my COVID vaccine. It wasn't well accepted. I got calls, oh, are you sure? Are you sure? I just want to tell them, everybody in my ethnic minority is very safe. Go and have it, go and protect yourself, protect your family, and protect everybody. I've had it and I'm fine.
I would like to encourage all my colleagues at Somerset Hospital, my family, my colleagues in the community, please take this vaccination. Protect yourself and whoever around you. Thank you.
Brothers and sisters in the community, it is Imam Rafiqul Alam. I'm taking my COVID-19 vaccine today in South Hospital. So just showing you that I'm taking my vaccine. Okay, and side effect, we'll tell you later on what is the side effect. More side effect is people talking against it.
Are you happy, sir?
Yes, thank you.
Shall we go ahead?
Thank you.
Oh, done.
Good.
It's easy.
No sticker?
Good.
No sticker?
No. No.
Thank you. Thank you very much.
Perfect.
Thank you, everyone. Assalamu alaikum.